Okay, so we were here when we stopped last. We didn't have time to magnify, but here we go. This is the incarceration again, or whatever. So we'll just see a transition between living normal mucosa, and then a dead mucosa here. It's like this is the dead one, that area, and this is the living. So a form of coagulative necrosis here too. See some hemorrhage here. And this is the normal mucosa on the other side, you see. So probably there was some arterial occlusion and this area died because it was supplied by the artery. Now in the book there is a picture of a dead artery too, but I don't know if I can find it. Maybe this one. Or this one actually. No, this one is alive, or whatever the hell it is. Okay, forget about it. This is it. Wow, this is a nice. Okay. That's it. I don't want to spend more time here. I'm guessing you don't want either. Okay. Moving on. 19, nutmeg liver. Okay, you can almost see that it's kind of whitish spots, even microscopically like this, I mean histologically. Although it is a macroscopic name based in that. Okay, so here you see it, nutmeg liver. Okay. As usual. Oh wait, let me see if the name is right. Yeah, I'm not wrong here. Okay. So this is due to shock, if I'm not wrong, or some form of ischemia. So if you zoom in, if you remember the alcoholic patient, this will not look like that. Kind of the opposite of that. Here you're supposed to see the fatty areas like a bit further away from the portal vein, or central vein, I'm sorry. So you see here, like when it stops loading, so you see here the cells survive kinda because they were getting blood supply, while the ones further away are dead or have fatty change. So it gives a characteristic thing. Okay, so for the theory of the other one, also the alcoholic patient, there you have toxins, so the ones closest die first or have the fatty change, and the ones further away survive. Okay, that's it. This is the slide. Nutmeg liver, or liver in shock. Call it whatever you like. Number 19. Hemorrhage, infarct of the lung. This is the way that looks. No, sorry. Why the number is okay. Here it is. This is the big picture. This is the alveoli, I guess. This area looks weird. Some hemorrhage here. Okay. Going in. Damn, I'm tired of working in underpants, man. Okay. There you go. Zooming in. So So we're supposed to see hemorrhage, or here we are, right? Yeah, and it is pretty visible here. Prove that this is the lung, this is the lung. These are the alveoli. You're probably going to see some red blood cells somewhere inside the septa. I guess here, a bit here, I don't know. This area here looks very messed up. Yeah, the whole architecture is kind of messed up. See, this was one day usual architecture, and on this, now it looks like this. So, okay, that's it. That was the hemorrhage infarct of the lung. 21, edema of the lung. This is the way it looks. Very pale. Although the staining is not special. Okay, going in. The computer's getting tired. As my hand is. So here you have the left-sided failure of the heart. Increased hydrostatic pressure in the lung. The result will be fluid is leaving into the alveoli. So these are the alveoli you see. And inside there is this transudate type thing. I'm guessing it's a transudate because it looks not so blue. As far as I understood, that is protein, so it's supposed to be kind of blue. So here, this is the alveoli, and this is the edema. I don't want to say anything else here. That was the pulmonary edema. 22, week 7, acute suppurative appendicitis. I can't even say that. Anyway, going on. So I expect a lot of granulation tissue, and I don't know, maybe even some bacteria in there, I don't know. This is the way it looks anyway. I don't have much time left. Didn't do enough slides. I wish I didn't have a time limit. Come on. Okay. So this is the pus or whatever here, and I'm guessing there's a lot of granulation tissue here. This is it. I mean, this is what you see. You see this pus or whatever inside here, and then you see the lymph nodes or whatever are enlarged. There's not much to see. It's acute, so they don't have much time to adapt, but this is what you see in the middle. I don't know if you can see anything else. I don't guess so. I mean, I guess not. I don't want to spend too much time on it. I don't do one more slide. Okay, that was the acute, that was the purulent meningitis. This is the one. Doesn't follow the order of the book, so I'm kind of unprepared. Difference between meningitis and encephalitis is what? Meningitis affects the meningia. Of course. This is the way the slide looks. I'm sorry I didn't do that. Okay. 30 seconds going in. This is the meningia, and this is a lot of granulation tissue. And if you know your histo, you will probably also recognize the brain. Here. Here. and the meningia are full of granulation tissue, I guess.